The question here, the community health nurse is providing a teaching session about the anthrax. So the question related to the anthrax, and anthrax is a biological toxic substance. And anthrax is spreaded or caused by bacteria. It is called bacillus. And if the anthrax attacked, we follow the standard precursor. So now the community and ask the participant about the method of transmission, which answer by the approved participant would indicate that teaching was effective. So healthcare provider educate them, and when the participant responding, now which is a correct response, indicate my teaching was okay, and the feedback or remodeling is coming correct way. So first one, bite from ticks or deer fleas. So number one is not related to the anthrax because this is more common in the Lyme disease. Then inhale the bacterial spore, and this is the one of the choice because the anthrax inhaled through the lungs. It is inhalation through the lungs. Then through a cut or abrasion of the skin. Anthrax can transmit our gastrointestinal system or any injurious or any cutting site or abrasion area, right? Where the skin is breakdown, it is the way they get in. So this is the choice as well. Direct contact with the infected individual. So anthrax do not transmitted person to person or skin to skin, not contact precursor. And also sexual contact with infected individual, no evidence say that. And also they said injection of contaminated uncooked meat. As I told you, gastrointestinal system is one of the way anthrax can transmit it. So what is the rationale here? They said anthrax is caused by a bacteria we call Bacillus anthracis and can contacted through digestive system or abrasion of the skin. So if your skin is breakdown, cutting, abrasion, they can get in. Also inhaled through the lungs. It cannot be spread from person to person, and it cannot contacted via the bite from ticks like Lyme disease. Not really. So let me tell something about the anthrax. And anthrax, as I told you, sometimes we use in a war as a biological toxic weapon or substance. Anthrax is a standard precursor we need to follow. Anthrax is treated by ciprofloxacin or treated by doxycycline. So if anything related to the standard precursor like anthrax, always we used for care of all client. When you're dealing with any client, we follow the standard precursor because standard precursor can prevent direct contact with all body fluid. And standard precursor routinely practiced by all healthcare providers. And it is safe for you, it is safe for your patient. And standard precautions basically include hand washing and don the gloves, right? Here, what next? Question here, the contact precursor. So examine, make our question easy because of this keyword. Contact precursor are initiated for a client with a healthcare associated infection, which is called nosocomial infection, caused by methicillin resistant staphylococcus aureus. So we call MRSA. So MRSA is a contact precursor. In this question, examiner already started the question contact precursor, which is MRSA. The nurse prepared to provide colostomy care and should obtain which protective item to perform this procedure. So question is here important. It is a contact precursor, my friend. We can follow the standard precursor like gloves and gown, but I said, when you deal with the patient also colostomy care, so fluid can chance to spread out, fluid can flush out to your body, so you need a complete protect, right? So it is, so when you see the colostomy, you can change the, you have to think critically. Contact precursor, MRSA is a contact precursor, I need to follow, but patient is a colostomy care need to. So fluid can chance to come in contact. Which protective item we perform this procedure? So gloves and gown, if it is only contact precursor like MRSA only, then gloves and gown is good choice or answer. But the patient, you need to deal with the colostomy care, right? So gloves and goggles, you must gloves and gown. What next? Gloves, gown. Number 2 is not an answer, at least you're sure. You gloves, gown, and also shoe protector. What about number 4? Gloves, gown, goggles, and a mask or face shaded. I choose number 4. 2 reasons. One reason, the gloves and gown is answer, it would be answer if it is only the contact precursor, but you are dealing with the problem who have a colostomy care, so need to fluid need can possible to flush out your body, so you need more protection, right? And number 4, we choose, it is the more information is there, all of this is here, and so many things is joining by comma, and I told you, and also join the sentence by and, right? There's some clue to answer this one as well. So what is their rationale? They say the flush of the body secretion can occur when providing the colostomy care. Goggles and masks or face shaded are also we can wear to protect the face and mucous membrane of the eye during the interact with the patient who have a colostomy, need to care. So may the product flush out of the body or body fluid, secretion or excretion. In addition, contact precursor require the use of gloves and gown should wear if the direct client contact is anticipated. So this is the reason we chose this one. So let me share some more information about the contact precursor. The question started by contact precursor. So contact precursor means direct or indirect. What is direct contact precursor? Means contact with client's cutaneous area or skin. Or indirect contact precursor means contact with contaminated surface or contact with bodily secretion from the patient. So it is good if anybody has a contact precursor like Clostridium difficile or herpes simplex virus or MRSA, rotavirus, herpes zoster, varicella, infected pressure ulcer, it is good to give them private room or cohort with same organism. We call cohorting. Also, gown and gloves upon entering the room, it is good to wear. And also change the gloves after contact with infected materials. And you don or you wear the personal protective equipment using correct consequence. What is correct consequence? Better to wear the gown than mask or respirator, then wear the goggles, and finally gloves. When time will come to remove the personal protective equipment, we use the correct consequence during removal. We remove the gloves first, then remove the goggles or face shade, then remove the gown. During the remove the gown, always inside out, and then remove the marks. But keep in mind, the front of the marks is contaminated. We do not touch in the front. And always we could wash the hand. And when you wash the hand, do not touch anything in the environment after hand washing. Right? And also, if your patient has a contact precursor, remove the, limit the transport of the patient. It is important. And what next? The nurse is caring for a client with meningitis and implement which transmission-based precursor for the client. So the disease is called meningitis, right? So meningitis is a droplet precursor. So patient must follow the droplet precursor, easy way. So if anybody have a meningitis or other droplet precursor like bacterial pneumonia or epiglottitis, pertussis or whooping cough, mumps, rubella, what we have to follow, right? So in case of meningitis, we basically wear the surgical masks, and when you wear the surgical masks, if you give the service within 3 feet of the patient, meningitis is a droplet precursor, we give them private room, right? And patient must wear the surgical masks if they need to transport, like one unit to other unit, and also limit the transport, important. So question here, which is the best option? Private room or cohort the client? Personal respiratory protection device, private room with negative airflow. So number 2 and number 3 is most appropriate for airborne precursor like measles, tuberculosis, smallpox, or varicella. But it is meningitis is a droplet. So number 2 and 3 is not for the meningitis. When marks on by the staff when client need to leave the room, no, it is not good choice. Private room or cohort the client in the same organism, the same room if they need to share. It is the best option out of 4. So what they said, meningitis is a transmission by the droplet infection. So it is a droplet precursor. So include the private room or cohort the client, use a standard precursor and precursor marks, and also private negative airflow pressure rooms or personal respiratory precursor device are required for the client with a airborne disease. So if the patient has a airborne, we better to use N95, particularly respiratory marks, and also negative pressure private room and door keep closed all the time if it is airborne, right? But our patient is a droplet, so give private room and cohorting the client. So if the droplet precursor like meningitis, we provide the private room, and patient affected with private room and also the cohorting. Cohorting stand for, or it does mean, so patient affecting with the same organism may share the room. It is called cohorting. Same organism, same infected person should be shared. And also maintain the 3 feet distance between patient and visitors or patient with healthcare provider. Masks to be worn when working within 3 feet of the patient. Limited the transport. What does it mean? Like your patient in a medicine ward need to transport in radiology department for chest x-ray. So in that cases, definitely they should go, but marks the patient if need to transport, but try to limit the transport for them. Question here, the nurse is preparing to give a bed bath to an immobilized client. So immobilized client with tuberculosis. The nurse should wear which item when performing this care? So tuberculosis, basically this is the airborne precursor here. So if any patient are airborne, we educate them to wear N95, particular respiratory masks. Very important. You must know for NCLEX board. So number one, surgical masks and gloves, particular respirator, gown and gloves, right? So in case of airborne precursor like tuberculosis, measles, varicella, or smallpox, give them private room, door must be kept closely, N95 masks, and limit the transport. So particular respirator and protective eyewear. Number four, surgical masks, ground protective eyewear. But number two, protective respirator, gown and gloves. This is the more important. Number three say particular respirator. Number 2 and 3, here's the gown and gloves. But here, gown and gloves is missing, number 3. Right? So number 2 is appropriate because of respirator, gown and gloves is there. Number 3 also respirator, but there are no gown and gloves mentioning. What is their rationale? The nurse who is in contact with a client with tuberculosis should wear an individually fitted particular respirator. The nurse also would wear gloves as per standard precursor. The nurse wear a gown when the possibility exists that the clothing could become contaminated, right? So we chose the particular respirator, gown and gloves. Let me tell something more about airborne precursor. The airborne precursor, the disease including measles, other name is called rubella, or varicella, we call chickenpox, tuberculosis, it is the Mycobacterium TB, or SARS, severe acute respiratory syndrome, smallpox, or H1N1. This is the list of disease we call airborne, right? So if my patient diagnosed airborne disease, what are the precursors we could follow? So give them private room and door must be kept closed, and give them masks. Special, it's called N95 particular respirator masks. Room negative pressure inside the room. No, not only the private room, door closed, also negative pressure. And patient wear surgical masks during the transport and limit the transport. So in the last box here, I just left in case of airborne precursor, door you can keep closed, whereas the droplet precursor or contact precursor, you can keep the door open. The nurse preparing to give a bath and change the bed linen for a client with cutaneous Kaposi's sarcoma lesion. So Kaposi's sarcoma, it is the type of the skin cancer. So the lesions are open and drain a scanty amount of serous fluid, which would the nurse incorporate into the plan during the bathing of the client. So number one, wearing the gloves. But in this patient, first of all, Kaposi's sarcoma, it is open, the secretion came out. So only wear the gloves is not protected. Wearing a gown and gloves, this is more better than one. Number three, wearing a gown, gloves and masks. Basically, masks we could wear if the patient is a airborne or droplet precursor. But our patient here, nothing related to this, right? And here they said that need to change the linen soil materials. So we must wear the gown and definitely gloves as well, but no need masks. So 1, 2, 3, 2 is a good choice. What about the number 4? Wearing a gown and gloves to change the bed linen and gloves from the bath. No, the patient has a open and draining a scanty amount of serous fluid from the cutaneous lesion. This is the reason most of the times, whatever the linen change or bathing, we must wear the gown and gloves. This is the reason we choose number 2. What is their rationale? Gowns and gloves are required if the nurse anticipate the contact with the soiled items such as those with wound drainage, or in a caring for a client who is incontinent with diarrhea, or a client who has an ileostomy or colonostomy. Masks are not required unless the droplet and airborne precursor are necessary. Regardless of the amount of wound drainage, a gown and gloves must be worn. What next? The nurse is preparing a group of the Scot for overnight camping trip, and also instructed the Scot about the method to prevent the Lyme disease, which statement by one of the Scot indicate need further instruction. So there are 4 options. Which one is wrong? I need to re-educate them. I need to correct them, make them correct, right? So here, I said there are number 4 option. So I need to correct them, right? So keep in mind, the Lyme disease is more common in some part of America, right? It is, so we must know, especially a type of tricks, or we call tricks-borne illness, caused by the bacterium Borrelia burgdorferi, the tricks name. They can transmit and causes this disease. And also their tricks can carry the bacteria that causes the Lyme disease. So I need to bring a hat to wear during the trip. So the hat can cover the head area. Nothing bad, nothing wrong. I should wear the long sleeve. Yes, very good. So if your hand or feet is exposed, open up, more chance to bite by the sticks. So it is nothing wrong. I should not use the insect repeller because it will attack the tricks. I will not use. Definitely, it is wrong. Not use. I need to wear closed shoe and sock that can pull up over my pants. So number 3, I am not sure, but I am over sure number 1 is okay, number 2 is okay, number 4 is okay, nothing wrong. So number 3 is answer. You understand how I can choose the answer? Like number 1, number 3, I'm not sure what is insect repeller, but I'm sure number 1 is nothing wrong, number 2 is nothing wrong, number 4 is also good to prevent the Lyme disease. So number 3 is only one option. Something wrong, I need to correct my patient, right? So Lyme disease causes by the bite of a deer ticks. In some part of America, it is more common, like New Jersey, Connecticut, right? So the first sign of Lyme disease patient develop erythema, and the skin lesion start 2 to 30 days after the bite. It takes time to start the sign symptom of the disease, and it is begin as a bump or macular or papular rash, right? So let me read it first. So in the prevention of Lyme disease, individual need to instructed to use an insect repeller on the skin and also close when in an area where tricks are likely to be found. Long sleeves tops or long pant, closed shoes and hat or cap should be on. If possible, heavily wooded area or thick under the bush should be avoided. So basically, if patient have a chance to bite by this, some lab test help to find out what are the lab tests we could do and what are the treatment option as well. We have to know. And let me explain. So if patient develop the Lyme disease, or if the patient is bite by the tricks, so they develop some of the sign and symptom. We categorize them early sign and symptom. Early symptom, basically, patient develop fever, chill, headache, and fatigue and tiredness. Sore muscle, swollen lymph node. Also, patient complain the headache, rash develop, and also flu-like symptom and erythema, red marks. And the later or very late stage, we call later symptom, bull's eye rash, meningitis, Bell palsy, or weakness or numbness of the limb, nausea, vomiting, eye infection or inflammation, joint pain and arthritis, and also the heart problem. So if your patient have this, what are the laboratory tests for confirmation? The lab tests include the complete blood count, shortly called CBC, or we can check the erythrocyte sedimentation rate, ESR. E stand for erythrocyte, S for sedimentation, R for rate. But usually ESR would be normal, and CSF study, cerebrospinal fluid test, and we could check the Lyme serology. What are the treatment options? So if the diagnose very early, that times we choose amoxicillin or bibramycin. But if diagnosed after 3 days, or if within 3 days of the bite by ticks, we give them doxycycline, right? What next? Question here, a client with a tuberculosis, those status is being monitored in an ambulatory care client, and ask the nurse when it is permissible to return to the work. What factors should the nurse include when responding the client? So when a TB or tuberculosis patient supposed to go to the work, because tuberculosis is a airborne disease. It is contaminated and it is easily to infected other person who is come in contact, right? So tuberculosis basically caused by the Mycobacterium TB. It is an acid-fast bacilli. And tuberculosis is spreaded by airborne or droplet nuclei. And keep in mind, if anybody is infected by TB, isolate them, give them private room, negative pressure inside the room, and wear the N95 masks. But an infected person, when the infection is active, right, they're not allowed to go back to the work. But when infection is subside, latent or inactive, they are allowed to go to the job. But when and how, we understand, right? So keep in mind that tuberculosis, basically there's some risk factor like malnutrition or malnutrition or overcrowded living condition, poor socioeconomic status, IV drug user, or immune dysfunction. They easily get up by TB or tuberculosis. 5 blood culture are negative. No. 3 sputum culture are negative. Then you are allowed to go to the job. So this is the choice. A TB patient, when 3 sputum tests should be negative, they are allowed to go back their job. The blood culture and chest X-ray are negative. The sputum culture and tuberculin test are negative. But basically sputum culture is more accurate. So 3 tests when come, we are there allowed to go to the ward. So the client with tuberculosis must have sputum culture performed every 2 to 4 weeks after initiation of anti-tuberculosis medication therapy. The client must return to work when the result of this sputum culture are negative because the client is considered non-infectious at the point. So basically, the TB patient we diagnose first by chest X-ray or sputum for AFB or PPD, right? And also, when a patient is a TB, what are the nursing intervention? Let me explain. So the most common sign and symptom of the TB, sometimes TB is asymptomatic, means patient are positive Mycobacterium TB, acid fast bacilli positive, but they does not have any sign and symptom. We called asymptomatic. But most patients present with low-grade temperature or fever, evening rise of body temperature. Also, patient present with night sweating or pleurotic chest pain or anorexia, fatigue, malaise and weight loss or chronic productive cough, sometimes purulent sputum or hemoptysis. How we diagnose a TB patient? By chest X-ray or sputum for acid fast bacilli, shortly called AFB. So when sputum for AFB, 3 negative AFB sputum to discontinue isolation, means when 3 tests will be negative, they are allowed to be go job. Or we can also do for PPD test or bronchoscopy. So if your patient diagnosed by the TB or tuberculosis, what are the nursing intervention? Our first priority, respiratory isolation. Usually 2 to 3 weeks after starting the medication. Or airborne precaution we have to follow. Example, wear the N95 masks and educate our patient to cover the mouth and nose when coughing or sneezing. Also, dispose contaminated tissue into the paper bag, and good hand washing is very important, and marks the patient for transport. When they need to go for medicine unit to radiology for chest X-ray, they must wear the masks. And also make sure your patient take enough fluids and promote the proper nutrition. Give them oxygen as prescribed. And finally, medication like isoniazid or rifampin, streptomycin. But the patient who take the isoniazid, make sure give them vitamin B6 or pyridoxine to prevent the peripheral neuropathy.